Hello and good evening, everyone. Thank you so much for joining tonight's DYSIS Smart Colposcopy webinar on patient outcomes and experience. My name is Brent Palmisano. I'm with DYSIS Medical, and I'll be facilitating this evening. I'm joined by Dr. Amy Moon. Dr. Moon's a board-certified OBGYN. She founded New Moon Center for Women's Health in Carmel, Indiana, and with the vision of delivering exceptional medical care, service, and convenience to women. Prior to that, Dr. Moon served as the managing partner of Women's Health Alliance from 2008 to 2018, and that was acquired by St. Vincent Ascension. She graduated from IU, Indiana University School of Medicine. She's been focusing on treating women well since her first day of practice at Women's Health Alliance in 2001. Dr. Moon has been named top doctor by the Indianapolis Monthly every year since 2013. It's quite the accomplishment. And so before I turn the webinar over to Dr. Moon, I wanted to just provide some quick housekeeping instructions. The audience is muted. If you have questions, please type those in, and we'll turn those to Dr. Moon at the conclusion of the webinar, where we'll have a quick Q&A, and she'll be able to answer those. Now, I also wanted to let you know that throughout the webinar, you're going to hear reference to DYSIS Smart Colposcopy. And let me just quickly explain that DYSIS Ultra, that's the product, is a next generation digital video colposcope with an advanced cervical imaging system that standardizes every aspect of the colposcopic experience. And it also includes an easy to interpret adjunctive color-coded map that objectively quantifies the intensity and duration of the acetowhitening process to aid in identifying potential areas to biopsy. So that's DYSIS when you hear reference to it. And with that, it is my great pleasure to turn the rest of the webinar over to Dr. Moon, the next 20 to 30 minutes. Off to you, Dr. Moon.
Hi, everyone. I'm reporting to you from the hospital. As you know, I just delivered a baby about 10 minutes ago, so everyone knows how crazy our lives can be as OBGYNs. This is our agenda for the day, and we're going to kind of go through each one of those one by one. And the focus is really on the patient experience, but also clinically as a provider, why I believe so strongly in DYSIS technology. So what we've known about colposcopy is there can be inconsistencies among different providers, but we have additional challenges that are coming up now due to things like HPV vaccination. So as a larger percentage of our cohort of women come to see us who have been vaccinated for the HPV type 16 specifically, we're going to begin to see more lesions associated with non-16 HPV. Those lesions are actually harder to detect by traditional colposcopy. In addition, with our guideline changes, many of the abnormal paps that we would have traditionally done a colposcope on, like a low-grade pap, for example, perhaps with a negative HPV nowadays, we're going to not do a colposcopy on that. We're going to be waiting. So now we're starting to experience lower volumes, making us not as good. And then now that the screening intervals have increased to 1, 3, 5 years, we will have less opportunities to see patients that need colposcopy. So this really does decrease the sensitivity and the skill sets of the providers doing the test, not only now, but over time. What we want to do is we want to make sure we actually catch the lesion at the time the patient is presenting for that colposcopy. It becomes even more important now. When we use the advanced cervical mapping tools, it does increase our detection rate of CIN2+ by 44%. That is a considerable number. And certainly since I've been using the DYSIS machine over the past 4 years, I have had many occasions in finding a lesion that was hard to find and the computer guiding me. So I've experienced it in real time, and I certainly have the confidence behind the technology. The other thing is to consider is how the cervical changes immediately versus over time. So the machine makes you wait at least 120 seconds before you can get any of the mapping. And so you're going to get more acetowhite the longer you wait. And we will have more confidence in knowing that we can diagnose these lesions and I think that's what we all want. We're going to go through some images kind of to allow people who haven't seen the advanced cervical mapping to see how it works in real time. So that was a fast forward video that really was actually 2 minutes in time, but taking a picture every 7 seconds. Over the time of that extended 2 minutes, you can see based on the graph on the right there how the intensity of that signal really got better. And you can also see how the map overlays onto the cervix and allows you to help find your directed biopsy sites. We're going to go through a couple of cases and really good examples and a little bit of a slower dynamic so you can kind of see how that evolves better. This is a picture of the actual machine. It's really small. It probably looks big, but it's really pretty small. I actually wheel it into the exam rooms. I don't have a special colposcopy room. My medical assistant can wheel it wherever we need it in the office quite easily. It has built into it a beautiful image capture, kind of like an iPad and a touch screen. You can share your exam notes on the machine itself so that if you were going to be looking at it at a later time or showing it to a colleague, or if you have any physician extenders who do these for you or beside you, you can actually put notes in there. The interpretation will be stored on the machine, your exam review. You can monitor changes. I actually did that today. I have a patient I've been monitoring for her CIN2, and she's young. So instead of treatment, we chose to monitor it. And then she came back for a colposcopy. We were able to see that it was CIN1. And then today was her third colposcopy. And then the acetic acid is built into the actual machine itself. There's a bottle, and it's going to deliver a consistent amount of that acetic acid wash right into the vagina for you in like a spray. So you're going to get a consistent amount of acetic acid placed onto the cervix with this machine. The DYSIS difference is really significant when you have the color coding. The areas will pop to you. It's sometimes like finding a needle in a haystack, but it allows you to really compare in a way that you don't have before because it's literally side by side and it's a video. So it does give you a lot of confidence in trying to remember where a lesion might have been in the past or where you biopsied in the past, where you may just have like a handwritten drawing. This is a real high digital image, and it's blown up really large, so it's very easy to see. So this is kind of how it impacts the patients as well, because it gives them an opportunity to also see their cervix. So in this patient, they had positive HPV 16 and they had a high-grade lesion. And so this is going to kind of show you the challenge in finding this. So the spray has been put on, and you can see those areas developing into the acetic white. Imagine in your mind, just take a second here and ask yourself, if I were to take a biopsy of this cervix, where would I like to take it? And just draw your imaginary X, because we're going to show you where a lot of other clinicians chose. So the study participants were able to mark an X as many places as they want on where they would like to biopsy. And it's kind of all over the place. There's obviously a focus at the top where you see the thickening white. There's the thickening white on the bottom, and then there's some other areas that draw interest. When you overlay the map and show the pathology, you can see that there is a strong area of signal where the red is. And when that area was biopsied, it did show CIN3. So it was able to focus in on that one particular very small area. And when you go back, a lot of the areas that people biopsied would have missed that if you weren't able to focus in on that. And some of the people put an X there, which was great. They've got good skills, but this will help your skills be even better. It's always important that you mark your areas first, because you don't want to not biopsy areas you're concerned about. And most certainly, I encourage you, DYSIS encourage you to take as many biopsies as you feel is necessary. So you can always biopsy all of the sites that you feel are clinically important, but you can also add any additional sites that DYSIS might draw your attention to. The next case that we're going to look at is a 45-year-old woman, premenopausal, non-smoker, 3 babies. And she was having some heavy periods with pain when she was found to have an atypical squamous cell pap with the high-risk HPV that was non-typed. When we go into her DYSIS imaging and you look at after the 2 minutes of the aceto-white, I think you can imagine some areas of aceto-white. I certainly feel like I can see some of those. You can get distracted easily by the Nabothean cysts and some of the vasculature on this cervix. The person who happened to be doing this colposcope felt that this was a normal looking cervix and didn't particularly think they needed to do any biopsies on their initial impression. But when you add in the mapping, you can see the area of focus right at 12 o'clock, where you can see that strong signal once again with the yellow, white, and red areas. You can also see, and this can be confusing when you first start using this machine, that there's some areas like on the side vaginal wall that show up as red. So you're always going to want to toggle back and forth between your map and not your map while you're looking at it. And you can also see some areas closer to the cervical opening that have some red and some yellow and some other strong signals. And as a clinician, you can continue to decide how many biopsies it is you want to take. But that area was an invasive cancer, and the patient was able to undergo her radical hysterectomy where they found it was a 1B1. So most of us don't consider the fact that our ascus and high-risk HPVs will go straight into an invasive cancer. That's not typical, but this mapping system was able to help identify that area of focus so that the biopsy could be obtained, and then the appropriate treatment was able to be used. This is our third case study. This is a 41-year-old white Caucasian. She is a smoker. She's had 2 children. And on her previous screening history, which you can see was kind of going at less than a frequent interval of once a year, she went 4 years, 2 years, and then 3 years. She had had the normal PAPs previously. This PAP came back with high grade and a positive HPV without typing. These are the pictures that developed with the aceto-white and time. It kind of goes straight into the mapping, and you can see the areas there. And the area of biopsy under the 1 was an adenocarcinoma in situ. This particular patient did very well. I think one of the things to also think about that the literature has shown us is that lesions of adenocarcinoma are more difficult to visualize than the lesions associated with a squamous cell carcinoma. And we all know that these can have skip lesions. So being able to find that one focus, the area of the biggest concern, once again, became very advantageous for this patient. So these are the kinds of things I've seen in my own practice, where patients have come where they've had colposcopies of the traditional sense and kind of had that frustration that their PAPs continue to be abnormal without resolution. And the DYSIS has been able to help me find that localized lesion of disease and then go into a treatment to clear them. So it happens pretty frequently. In the past year, I've done 80 colposcopies. I looked back through my machine and kind of began to look at how many times did it direct my attention to another spot. And it's a lot. It's at least 1 out of 4, 2 out of 4, where it's bringing my attention to an additional area of biopsy. This is a 33-year-old woman who had an ascus pap with a positive HPV. After adding the acetic acid, you're able to see how those areas are getting more bright and thicker. You can see areas of mosaicism and even it looks like some leukoplakia. Imagine in your mind again, because I think that makes this the most powerful, where in fact would you take your biopsies if you were this clinician, and then take a look at the map on the biopsies and how they correlated. So you can see where the original biopsy was made, biopsy number 1, that did show the CIN1. On the posterior side, biopsy site 2, once again, CIN1, but localized just in that lower area where the red signal is very, very strong. That was the area of the CIN2, and you're able to see that on the map. This really does give patients a lot of reassurance and really helps calm their anxiety. This is the power behind this tool from the patient's perspective. We like it as clinicians, but how do the patients really like it? So what they did is they went out and asked the patients, please respond and how your anxiety was before, during, and after your colposcopy. And they did ask 300 women who were having their very first colposcopy ever. And in addition, there were 200 women who had had a prior colposcopy. So the patient's anxiety was shown. How nervous were you before coming into your appointment? So 7 out of 10, 5 out of 10. Now you've talked to your patient and told them exactly what it is we're going to be doing today and how that's going to look and what you're going to be using. And you're showing them the tools and the pictures, and their anxiety is already to be coming down. But now you've finished your colposcopy and you've shown them their maps and shown them their biopsies. How nervous are they now? So it's gone down dramatically. Patients' anxiety is dramatically improved with this type of technology. What was the patient's impression of the DYSIS? Did you feel that it took longer? The people who'd never had it done before might have thought it took longer than the people who have, but interestingly, the people who had a traditional colposcopy did not think that it took much longer. And they didn't find this intimidating. It wasn't something that scared them. So understanding the map, the patients think that it's generally pretty easy to understand. 8 out of 10 and 9 out of 10. The graphics are really quite clear. And how much did that reassure you, being able to see the actual map of your cervix? And 9 out of 10 people felt like that was a very strong tool. In addition, they asked the patients if you needed a colposcopy again, would you rather have it done on the DYSIS? Very strong response, 10 out of 10. And if they had a family or a friend that needed it, would they recommend it? And once again, that was 10 out of 10. The doctors like it, and the patients really like it as well. It is an excellent tool. And from a patient perspective, I've had a patient tell me, I'm not afraid anymore. And I think if we want to get to any of the questions, now would be a good time.
Well, that was great, Dr. Moon. Thank you so much for sharing your thoughts with us regarding patient experience and outcomes with DYSIS. A few questions have come in that we'd love for you to answer. The first question is, and you've alluded to this a little bit earlier in the webinar, but how will DYSIS help me to conservatively manage patients?
Yeah, so because the DYSIS Ultra does have that superior onboard smart track feature, and I was able to use it today, you're going to be able to replay the video of the entire colposcopy of both the original and then the one that you're doing, or if you've done more than 2, you can pull up the 2 that you'd like to do, and you can play the video in real time side by side. So you're able to see the lesions develop into their aceto white, and it actually maps the intensity of the signal on a graph with a barcode. So I was able to see the intensity of the lesions going down when we're going from a lesion that's CIN2 to regressing to a lesion that's CIN1. And that's a real time measure that you can give back to the patient. That's not something that you're waiting for the biopsy to come back and tell you, because you're going to confirm that, but you're able to actually see that while the patient is there. You're also able to see if the intensity is worsening. So the smart track technology is very nice.
Great, thank you. And Dr. Moon, another question for you. How do you biopsy with the imaging head, so that's the camera, attached to the speculum? Can you elaborate on that, please?
Well, it actually works really well. There is ample distance between where the colposcope is attached to the speculum and the area that you would need to put a tool in. I would say in real time, from the head of the colposcope to the vaginal opening, you've got a good 6 or 8 inches. So you're able to put in your local anesthesia, you're able to put your biopsy forceps in, you can easily do the endocervical curettage, apply whether you need to do silver nitrate or Moncel solution, and you can keep it attached the whole time. You have plenty of room to do that while you're watching, and then you can be really confident that you got like the spot that you needed. So I find that to be a very simple feature.
Okay, excellent. And we have time for one more question. And so, Dr. Moon, what is your advice when introducing DYSIS in regards to training physician extenders in your practice?
Well, certainly there's a large web-based training platform if you're thinking about training like medical students, or if you're training like medical residents. If you're doing it more in your own office setting where you have physician extenders, every exam is recorded to be reviewed at a later time. And you can also look at interesting cases for educational opportunities. We could pull up my DYSIS tonight. I could sit down with my nurse practitioners and we could go through all 80 colposcopes we've done in the past year if we wanted to, so that we can really educate the extenders and we can work together for the patients. So it's a permanent picture that everyone can look at now and later.
Well, thanks again, Dr. Moon. What a great presentation and webinar. Thank you for answering those questions as well. And folks, thank you for attending. For anybody who wants to view this video again, please feel free to find it under DYSIS Medical on our YouTube page. Take care. Have a great evening.